Mental illnesses account for more disability than any other group of diseases, including cancer and heart disease. It's so common that 1 in 4 adults has suffered from a problem in the past year, and half of all U.S. adults will have at least one mental illness in their lifetime. But mental illness covers a wide range of problems. We'll start with the most severe. Schizophrenia is a psychotic disorder which causes delusions, that is, false beliefs that people are plotting against them. It also causes hallucinations, that is, hearing or seeing things that aren't there. It's difficult for people suffering from schizophrenia to hold a job, live on their own, or take care of themselves, and treatment involves medication, therapy, skills training, and education for the entire family. Bipolar disorder involves unusual mood swings from very happy to very sad and hopeless. If untreated with a combination of medicine and talk therapy, bipolar disorder can lead to broken relationships, poor school or job performance, and even suicide. Clinical depression, which usually starts between the ages of 15 and 30, is more than just being down in the dumps for a few days. It's persistent sadness, loss of enjoyment in activities, loss of energy, and feelings of being worthless. While fear and anxiety are a normal part of life, anxiety disorders just don't go away. They may even get worse. Those who suffer from anxiety disorders get chest pains, have nightmares, or are afraid to leave home. Examples of severe anxiety includes panic disorder, obsessive-compulsive disorder, and post-traumatic stress disorder, or PTSD. Other mental disorders with which you may be familiar include eating disorders such as anorexia and bulimia, autism spectrum disorder, ADHD, attention deficit hyperactivity disorder, and substance-related addictive disorder, which now includes gambling. There are many possible and varied causes of mental illness. Pardon what seems like a long list. It begins with genes and a family history. Other biological factors include a pregnant mother's exposure to viruses or toxic chemicals. Yet another factor is injuries such as traumatic brain injury. Then there are adverse life experiences. These might include a history of physical, sexual, or emotional abuse that continues to haunt a person. Veterans of any war who experienced violence and death all around them likely experienced a difficult readjustment upon returning home. Survivors of natural disasters such as hurricanes, floods, and forest fires, in which a person may have lost loved ones, as well as his home and all of his personal possessions, are often severely traumatized. Finally, for many, the fear of terrorist threats and the horror of terrorist attacks have become an all too frequent fact of life, not only here, but all over the globe. All of these examples are likely triggers for the onset of mental illness. What can be done about this personal and societal burden we call mental illness? There are medicines and talk therapy that have proved effective. In the latter, a therapist gets the patient to open up and describe his fears and demons, then redirects the negative thoughts to more positive ones, and helps the patient to learn and activate new coping mechanisms. The problem is that a majority of people don't know about available treatments, or they don't seek out treatment because of the misconceptions and fear of the treatment. In the past, for serious mental illness, patients became captives of mental hospitals or insane asylums, where they were often neglected or abused. Today, patients are treated in inpatient units for crisis care. Then they're returned as quickly as medically possible to their communities, where they can live in much less restrictive environments. As more people learn about mental illness and more people admit to suffering from it, mental illness is beginning to lose its stigma. That is, the negative associations attached to it. And as it loses its stigma, it's hoped that more people will actually get treatment and be able to return to productive, satisfying, and engaging lives. The U.S. Surgeon General's report on mental illness has provided some excellent guidance on the societal level. It says that we must continue to make the public aware of effective treatments. and do all we can do to decrease the stigma still associated with mental illness. We need to make sure that we have sufficient supply of mental health services and providers so that everybody who needs it can get care. Because there are big social and cultural differences within the population, we have to tailor treatments to different age groups, gender-specific groups, various races and cultures. And in addition to the primary care doctor and social services, prisons and even schools should be trained and equipped to recognize client need and help the client get into mental health treatment. Finally, we need to reduce financial barriers to treatment. The Mental Health Parity Act of 2008 is an important milestone. It forces insurers to pay for treatment of mental illnesses in the same way they pay for treatment of physical illnesses. Insurance companies can no longer discriminate against the mentally ill. A remaining problem, though, is this: what happens with the uninsured mentally ill? The Surgeon General goes on to warn that more than other areas of health and medicine, the field of mental health is plagued by disparities in availability and access to services. The poorest and most vulnerable are just left out when it comes to getting help. Isn't everyone entitled to the same opportunities for health and a decent quality of life? How then should we as a society go about equalizing opportunities?